Am I audible?
Yes, ma'am.
Yes, ma'am.
Okay. Turn on your videos. So I will just I will take your first aid theory. Okay. That day we were discussing about shock. S-H-O-C-K. Shock. Hmm? So what is shock? Anyone? What is shock?
Yeah.
Hmm?
It's a syndrome that
Read out.
results from decreased
Uh-huh.
shock is a syndrome that results from a decrease in effective circulating blood volume or fluid in the body as a result of injury or illness. It can vary from faintness to complete a collapse.
Hmm.
This is complete one.
Okay, and what about the other things? Effects of shock. Jyotishmita, what are the effects of shock? Jyotishmita, what are the effects of shock? Asna na Jyotishmita. Ayang Taku. Ayang Taku is there? Bill Clinton. Bill Clinton. What happened? You all are not answering. You have not written or I am not audible? Am I audible or not, all of you? Are you able to hear?
Yes, ma'am.
Others? Okay. Sajarika, you read out the effects of shock. Sajarika. Kajal, you read out the effects of shock.
Earlier loss of consecutions that
Consciousness.
mainly
Consciousness.
consciousness that mainly involves the nervous system and that may be fatal. Ma'am, what's that may be?
That mainly involves. Maybe no, it's mainly. M-A-I-N-L-Y, mainly.
No, ma'am,
Mainly
that
involves.
mainly involves the nervous system and that may be.
Hmm? That may be fatal. F-A-T-A-L, fatal.
Okay, ma'am.
Fatal means it might lead to death of the person. Okay.
Okay, ma'am. Progressive loss of blood from active circulation, which may lead to failing heart output and insufficient oxygen to cells that are vital for survival. Sustained lower blood pressure, which may lead to liver and kidney failure.
Okay. What are the causes of shock? Ashri Dev Burma. I guess you were present, Ashri. Ashri Dev Burma, you read out. Read out the causes of shock. What are the causes of shock? Check out, please read out the causes of shock. Ashri, read out the causes of shock. I guess network is not good. John Deep. John Deep, you read out the causes of shock. Read fast, Akon. Okay, Sakani, you continue. You read out the causes of shock. Maybe they are having some network issues.
Causes of shock. Number 1, severe or extensive injuries. Number 2, severe pain, heart attack. Number 3, loss of blood. Number 4, severe burns.
Not lose,
Number 5,
loss, L-O-S-S.
loss of blood. Number 4, severe burns. Number 5, electric shock. Number 6, exposure to extreme heat and cold. Number 7, allergic reactions. Number 8, gas poisoning, gas poisoning. Number 9, bite or stings of poisonous snake and insect. Number 10,
Or
poison
insects, not an or insects.
or insect. Number 10, poison taken internally. Number 11, emotional stress, pride. Number 12, certain illness. Program of shock. Number 1, blood flow in the entire body is disrupted. Number 2, blood flow the heart is decreased so that number 8, heartbeat grows faster. Number B, blood vessel near the skin and in the arms and leg constrict, sending most of the available blood supply to the vital organs of the body and to the nerve center of the brain. Number 3, blood goes to the brain and other vital organs so that body cells do not receive enough blood and therefore do not get enough oxygen and nutrients. Number 4, blood vessels, like the rest of the body, suffer from this lack of oxygen and they lose their ability constrict. So that vital lose their ability constrict. So that vital organ and the brain do not receive enough blood and shock wounds. Number 5, as the blood supply short of the internal organ and to the brain, the cell begin to the eye because the person. Number 6, it shown is not a reverse. The internal organ and brain eventually die. Factor influencing degree of shock. Number 1, pain. It increases the severity of shock. Number 2, physically condition. People who are
Physical condition, not
starved
physically.
or
Physical
exposed to
condition.
extreme of cold or heat fall in the shock easily. Number 3, fatigue. It increases severity of shock. Number 4, disease. People having chronic disease develop shock easily. Number 5, individual reaction. Shock varies from person to person. Number 6, improver evaluation care movement. Shock may be increased by rough handling and by delayed treatment. Complete, ma'am.
Complete. Okay. So now you write down the types of shock. Did I give you the sign and symptoms of shock?
No, ma'am.
Write down the sign and symptoms of shock. Write down the sign and symptoms of shock. S-H-O-C-K. First, you write down signs. S-I-G-N-S. Signs. Sign and symptoms of shock. Number A, you write down signs. S-I-G-N-S. Signs. Number 1, you write casualty is anxious and restless. Casualty is C-A-S-U-A-L-T-Y. Casualty is anxious and restless.
Ma'am, anxious.
Casualty is anxious. A-N-X-I-O-U-S. Anxious and restless. R-E-S-T-L-E-S-S. And restless. The second point you write down weakness, comma.
Ma'am, could you
Weakness.
repeat again? I got disconnected.
Okay. So we are discussing about the sign and symptoms of shock. Okay. Write down the sign and symptoms of shock. Number A, signs. We will discuss the signs and the symptoms separately. Okay. Number A, you write down signs. And then the first point is casualty is anxious and restless. Casualty is anxious, A-N-X-I-O-U-S, anxious and restless, R-E-S-T-L-E-S-S, restless. The second point you write down, weakness, comma, weakness, W-E-A-K-N-E-S-S, weakness, weakness, comma, fainting, F-A-I-N-T-I-N-G, fainting, fainting, F-A-I-N-T-I-N-G, fainting, and disorientation, and disorientation, and disorientation, and disorientation, D-I-S, disorientation, O-R-I-E-N-T-A-T-I-O-N, and disorientation. Disorientation means what? You are not oriented. Oriented means if I ask you what is your name, you doesn't know. You are like, what was my name? All this, mostly the psychiatric patient used to be disoriented. Okay, if you ask them what is the time now, instead of saying it's 6:15, they might say it's morning 6 a.m. They will say like that. They will ask you where are you now, instead of saying I am in Guwahati, they will say I am in Delhi, I am in abroad, I am in London. They will talk in this way. Ulta pulta mane. Okay, why? Because they are disoriented. They doesn't know what they are speaking. Okay. And weakness means durbal. Weakness means weak, being weak. Okay. And fainting means feeling of giddiness. Giddiness means what? Feeling of fainting. Okay. You will feel like fainting. Becoming unconscious. Number 3, you write down shallow, comma. Number 3, shallow, S-H-A-L-L-O-W, shallow, 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 S-H-A-L-L-O-W, shallow, comma, rapid or gasping breathing. Rapid, R-A-P-I-D, rapid or gasping breathing. Rapid or gasping breathing. Rapid or gasping breathing. B-R-E-A-T-H-I-N-G. Breathing. Or breathing. Next you write nausea. Number 4 point. Nausea. 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 Nausea mane feeling of vomiting. Okay, you will feel like you want to puke, means you want to vomit. Kintu it's not coming out, but you are just feeling, just having that sensation. Okay, nausea meaning. Comma, vomiting. vomiting, vomiting. Nausea, comma, vomiting. vomiting. Vomiting mane you already vomited, you already puked. Nausea mane it is just a feeling that you want to feel like vomiting. Vomiting mane it's totally you vomited. Nausea means it's just a feeling of vomiting. Okay, vomiting or extreme thirst. Or extreme thirst. thirst, thirst. Or extreme thirst. thirst, extreme thirst. Okay. Number 5th point you write down. Skin becomes pale. Skin becomes pale. Pale, pale. Skin becomes pale. Pale, pale. Comma. Cold. cold, cold. Thanda pori jai, okay. cold, cold. Comma. And sweating may develop. And sweating, sweating, sweating may develop. And sweating may develop. Sweating may develop. Means what? Your skin. Okay. The color of your skin might become pale, means a bit yellowish in coloration. You will even feel cold. You might even shiver because of thanda, okay, because of the feeling of cold. But at the same time, you will sweat. Okay, like for example, you can take malaria. In malaria, what happens? The patient becomes, they sometimes feel cold, sometimes they feel shiver, sometimes they feel cold. Okay, so what happens? The patient becomes okay. What I was saying that in okay, so the patient will sweat. Okay, skin will become pale, they might feel cold, at the same time they might sweat. Okay, next you write down symptoms. Next you write down symptoms. symptoms. symptoms, underline it. Then you write number 1, pulse rate increases. Pulse rate increases. PULSE, pulse rate increases but becomes weaker. Pulse rate increases but it becomes weaker. WEAKER, weaker. Okay, what is a normal pulse rate? What is a normal pulse rate? Tell me, what is a normal pulse rate? What is a normal pulse rate?
But
What is a normal pulse rate? John Deep, tell me what is a normal pulse rate?
70 to 82.
Okay. So what happens in shock? Your pulse rate will increase than the normal. Okay. Next you write down blood pressure falls. Number 2, blood pressure falls. Number 2nd point, blood pressure falls. FALLS. Blood pressure falls. That means your blood pressure will decrease. That means you might have low BP. Okay. Blood pressure falls. Number 3rd point you write down. Pupils are dilated. Pupils are dilated. Pupils are dilated. Pupils are dilated. Then you write down. Wait 1 second. I will show you one picture. One second, huh? Let 1 minute. Just wait for a second. Okay, next, my network is very slow. Next, you write down shaking and trembling of arms and legs. Shaking and trembling of shaking, shaking, shaking and trembling of arms and legs. Shaking and trembling of arms and legs, legs, legs. Shaking and trembling of arms and legs. So in shock, what will happen? Shaking, you will have lots of shaking, your hands and all will shake, okay, and it will tremble, your arms and your legs will shake. For example, you can take alcoholic person, a person who is alcoholic, okay, he trembles and he also shakes when he drinks too much, when he consumes too much of alcohol, he can, his body becomes shaky and he trembles, okay. Example is an alcoholic person, but here we are not talking about alcoholic person, okay, we are talking about shock, but I'm just giving you an example. Next, you write down number 6, unconsciousness may develop. Unconsciousness may develop means the person might become unconscious, okay. Unconsciousness may develop. Unconsciousness may develop.
Ma'am.
Next, you write number
Ma'am.
7. Huh?
This is number 5 or number 6?
Say, Sakani.
This is number 5 or number 6?
Unconscious may develop is number, sorry, 5, 5. 5, 5.
Okay, ma'am.
Okay, number 6, you write evidence of associated external and internal injury. Evidence of associated external or internal injury. Evidence of associated external or internal injury. Next, write down treatment. Next, you write down the treatment. treatment, treatment. First, number 1, immediately reassure and comfort the casualty. Immediately reassure okay. Immediately reassure and comfort the casualty. Number 2, body positioning for shock. Body positioning for shock. SHOCK. Body positioning for shock. 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 Okay, this wait, write down body positioning for shock. Write down, if the casualties condition allows, if the casualties condition allows, comma, if the casualties condition allows, comma, lay the casualty down network, my network is a bit bad. Okay, try to adjust. I will take for some more time. Okay, lay the casualty down on the back on a blanket. Lay the casualty down on the back. Lay the casualty down on the back. On the back. On a blanket. On a blanket. BLANKET blanket. Full stop. Keep the head low. KEEP. Keep the head low. Keep the head low. Keep the head low and turned on one side. And turned one side. And turned on one side. To maintain blood supply to the brain. To maintain blood supply to the brain. To maintain blood supply to the brain. And to lessen the dangers. And to lessen the dangers. And to lessen, LESSEN, and to lessen the dangers. To lessen the dangers of vomiting. Example. No example. In vomiting, full stop. That much only you write. I will repeat once again. Okay. First treatment. The first point is immediate reassurance and comfort the casualty. Number 1. Number 2. Body positioning for shock. Then you write down. Put a dash and write. If the casualty's condition allows, comma, lay the casualty down on the back on a blanket. Full stop. Keep the head low and turned on one side to maintain blood supply to the brain and to lessen the dangers of vomiting. Full stop. Okay. Next, you write down. Next, you write number. Bad today. So do one thing. I will end the class here. Okay. We'll take it tomorrow. Not tomorrow. Sorry. We'll take it on Monday. Okay.
Okay, ma'am. Okay, ma'am.
Okay, ma'am.
Network is very bad, so I will end the class here only. Okay.
Okay, ma'am.
So
Okay, ma'am.
study well for 19 October. Okay, I already told you about the test. Study unit 1. Okay. Study unit 1 and from unit 2 you can study hemorrhage and hemorrhage and what? What did I give? Hemorrhage and
Burns.
burn. Okay, burn and hemorrhage and unit 1. Only these three. Okay. From unit 1, the whole thing, and unit 2, hemorrhage and burn. So study well. Just study well, and that they don't give me any excuses. Okay, the network is not good, I can't on my videos, I didn't study, my mobile is bad. Means don't give all these lame excuses. It seems so
Okay,
much
ma'am.
misa kotha. It seems so much false. Okay, so don't make all these excuses, because whatever you are studying, it is for you. And you are not studying for me. Okay? You are studying for yourself. Don't make any excuses. Study properly and sit for the exam without
Okay, ma'am.
cheating.
Okay, ma'am. Take a video again. Take a video again. Hey, Mavi. Hey, up. Ping. Ping. You now they must.
Okay. Okay, then you can leave the meeting. Thank you.
Thank you,
Okay,
ma'am.
ma'am.
Thank you. You can leave the meeting. Okay.